lot.
94 units of blood.
Almost 2 years ago, but they can talk about it like it was yesterday.
When he came in off helicopter and they were just all ready and waiting.
It's one of those traumatic times.
Yeah, there was so much going on.
You relive and think it could have been the end.
I arrived at UK as it was with no blood pressure.
In an unimaginable hunting accident, Kenny No ended up at UK Medical Center for 169 days.
The tree went through my abdomen and just like a quarter of an inch coming out the top of my back.
You'll hear about somebody flown to UK, somebody going in, yes, and I'm like, I can relive it and I know what they're going through.
Okay, we have to go to the emergency department.
A place most hope they'll never know, but there is a curiosity, a hope that if you do,
It takes somebody in the hospital to be the trauma program manager.
you'll be in good hands.
When a patient comes fairly well injured, they activate the trauma team.
Moments after we met trauma surgeon Dr. Andrew Bernard,
Team responds, the team's ready.
word came that a patient with internal bleeding was coming in by helicopter.
We have 2 levels of trauma team activation, trauma alert and trauma alert red. So this was a trauma alert, but it's been upgraded to a red, so the patient must be unstable.
We followed Dr. Bernard downstairs to the trauma ER. The patient was still en route, but look at the hospital staff gathered in the hall. The intensive care nurse.
Yeah, there they are. Coming down. 124, 120.
The residents, the x-ray technicians, the operating room team, all waiting, ready to react to what's coming.
The team's pretty good at this, and it should unfold in a very predictable way.
The patient had a severe abdominal injury.
And the abdomen's negative, eh?
After no more than 15 minutes, doctors determined surgery will be necessary.
So it sounds like she needs to be operated.
And before we knew it, the room was empty again and ready for the next patient.
Trauma systems save lives
This medical center holds the title of a level 1 trauma center.
and increase efficiency and save money.
Dr. Bernard was a pioneer contributor to establishing a trauma system or levels in Kentucky.
You're 15 times more likely to die from injury in a rural area.
There's a scattering of trauma centers in the state now. They range from level 1 to level 4.
There's no difference in quality between 1, 2, 3, and 4.
The numbers speak to the services the centers provide.
And the public doesn't always get that.
A level 4 won't perform surgery on a trauma patient like a level 1.
Trauma fatality is just the tip of the big trauma iceberg.
But the lower levels are trained to give quick assessments to get the patients to the right level of care.
The emergency physician is really on the ball and knows what you need and can get you out.
He says, we did everything we knew medically, and there's no feasible reason for me to be alive.
Kenny No needed level 1 care the day that forever changed him.
I thanked them for saving my life many times.
A success Bernard says is owed to a team and a routine strategic system.
It's the biggest privilege in the world to take care of patients.
For patients that are anything but routine. In Lexington, Miranda Combs, WKYT.